Sleepless nights can lead to unhappy households. Whether you have a new baby, toddler, child, or teen, reaching 8 hours may be easier said than done. Stay tuned as we hear expert advice from Dr. Jack with Anthem Hills Pediatrics. So thank you, Dr. Jack, for coming on Medical Minutes.
You're welcome.
So today we want to talk about sleep problems. Sleep can be kind of hard to come by when you're a parent, whether you have a baby, a newborn, a toddler, or even all the way up to teenagers. What are some of the common sleep problems that you see throughout the stages?
Sleep problems are very common, especially between the ages of 1 and 4. With babies, they don't yet have a regular sleep cycle, so that's one of the problems with babies. And any parent will tell you that for toddlers, the hardest time of the day is bedtime. They might also have problems with nightmares, night terrors, or sleepwalking or talking. And with teens, it's the complete opposite of sleep deprivation, either by choice or by a medical problem.
So if we start kind of breaking it down a little bit, let's start with the infants. I know a lot of new parents, they're sleep deprived, trying to get their baby on schedule. Do you have any tips that can maybe help them, I guess, go throughout this phase?
So the American Board of Pediatrics actually recommends something called sleep training. An example of that would be controlled comforting. And this entails actually putting them down to sleep, settling them down to sleep, and then going back to check on them at increasing intervals when they cry. It's important to be consistent when you start this, and also set up a quiet bedtime routine and not overstimulate them. It's also important to remember that you don't want to leave when they've fallen asleep, because the whole essence of sleep training is to have them soothe themselves to sleep. And give it time. Like with any training, it might take a while for them to, it to kick in.
Yeah, just time. So parents really shouldn't be so hard on themselves and just ease into it and
Yes.
just let their child, get into that habit.
Yeah.
So you also mentioned kids and night terrors, and what kind of sleeping habits after the age of 4 do you see coming through your doors?
Mostly nightmares. At this time, kids have more vivid imaginations, and so they end up having nightmares. Sometimes even sleepwalking or talking, and bedwetting too is another problem.
And so what kind of tips can you kind of give for that stage? I mean, is this something that they need to come in and talk to you about, or is this something that they can work on at home? Like where's the medium ground on that?
With nightmares, kids just need to be reassured that you're right there and you're not going to let anything hurt them. It also might help to encourage them to talk about the nightmare. And with bed transitions, remember that it could make your child insecure, because it's a big move for a child.
Right.
And so it helps to act out the scenarios before you actually make the change. And even pointing out friends who are sleeping in big kid beds might help.
So this is when they transition from like your crib,
From
and
the
you put
crib
them
to an
into a
open
toddler
bed. Yes.
and or even just an open bed, like
Yes.
you said. So is that a common problem? Do you hear a lot about
It's very
that?
common. It's a very common
I
problem.
know a lot of parents are probably like, yes, I
Yes.
go through this. Please help me.
Yeah.
And then you mentioned that it turns around in your teen years. What are the sleep problems in your teen years?
In teens, it's a lot of times it's more by choice. In the age of the internet and video games and phones, it almost seems like they want to surf the internet or play games before they go to sleep. The sleep deprivation can affect every area of their lives, their relationships. They might be having mood swings, and even concentration in school, resulting in bad grades as well.
So with teenagers, it might not be a common stage problem. It could be sleep deprivation.
Exactly.
Okay, perfect. Well, this has been so enlightening, and thank you so much for all your tips. We really appreciate you coming on Medical Minutes.
Thank you.